So Work Package 1 from the PACE programme of research was undertaken as a joint venture with the European Association for Palliative Care, where we were undertaking a task force for them, looking at mapping palliative care provision in long-term care facilities and how it's being developed across Europe. So in this work we engaged with 29 European countries through two ways of collecting data. We used country informants from most of those countries and sent them a survey to ask them about activities around palliative care provision in long-term care facilities in their country. And we also drew on documents that were available publicly, other published reports, to get more information and data about what was happening. And so in our report that's available on the EAPC website, we've presented information about the context of care, about what long-term care facilities are doing in their countries in terms of how they're funded, how many beds they have, the sort of population that lives in them, how many people have dementia, to give a picture of the context for where palliative care is being provided. But what we've also looked at is the factors and drivers that are actually helping palliative care be delivered for people living and dying in those facilities. And we've identified through our work three levels of factors, three levels of drivers. The first being strategic national drivers such as funding and policy activities. The second being organisational initiatives to develop palliative care, such as education, promoting the use of particular tools and frameworks. And thirdly, we've also looked at the extent to which within each country we can see palliative care actually being delivered within facilities. Is it happening across the country or just in very isolated places? And using those three categories, we've looked at each country and kind of graded them as high, medium or low to see if actually what extent the activity is. And we can see that there is a pattern of development across Europe, that there are some countries where there is strategic activity, policies exist and funding exists, whereas there are other countries where there is very little happening at a national level to support this work. But what we can also see is that there are some countries where there is very extensive activity in care homes. Actually, people in residence in care homes are receiving palliative care, such as the Netherlands or the United Kingdom, but there are other countries where there is minimal activity. And it's that range of activity that we present and that picture that we present in our report.